Most people have heard of gallstones, but there is a lesser known cousin that shows up on ultrasound and quietly confuses everyone. Gallbladder sludge. Sounds harmless, like something you just wipe off a kitchen counter. But medically, it's a real entity and it deserves a little respect. Sludge is basically bile in the gallbladder that has thickened into a mix of cholesterol crystals, calcium salts, and mucin. On ultrasound, it looks like soft echoes that settle at the bottom of the gallbladder and move when you move. The key difference from stones? No shadow in ultrasound. Think of it as the pre-stone stage. Not normal, not a full-blown stone, but capable of behaving like one. Who gets it? Usually people going through some kind of metabolic or physiologic stress, rapid weight loss, frequent and long fasting, TPN, pregnancy, certain medications like ceftriaxone or octreotide. In other words, sludge is your gallbladder saying, boss, conditions are not ideal. Now the big question, what does sludge actually do? In many people, nothing. About 3/4 of patients either see it disappear or stay silent. But in the remaining group, it can cause trouble. It can trigger biliary type pain, cholecystitis, pancreatitis, or even slip into the bile duct and cause jaundice or cholangitis infection. Clinically, it behaves like a small stone equivalent. So what should you do if your screening ultrasound casually mentions GB sludge? First, don't panic. If you are otherwise healthy and have zero symptoms, usually no treatment is necessary. Avoid crash diets, stay hydrated, keep meals regular, balanced and low fat. Basically, don't give your gallbladder extra homework. If you do have symptoms, that classic post-meal upper abdominal pain, the usual advice is lifestyle changes or medications like UDCA. But if the pain keeps coming back, or if you have had pancreatitis or cholecystitis, then the definitive fix is the same as for stones: cholecystectomy surgery. The bottom line, sludge is not a diagnosis to ignore, but it's also not a reason to lose sleep. It's a signal. Unlike most signals in medicine, the response depends on the story, not just the scan. Keep watching Gut Instincts because understanding your body shouldn't feel like decoding a mystery novel.